Madam Speaker, I rise in support of H.R. 5657, the Medical Marijuana Research Act. Last week, Congress considered and passed the MORE Act, which effectively removes marijuana from the strictest category of regulation under the Controlled Substances Act. Today, medical marijuana is approved and regulated in 37 states, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands. These actions highlight the need for increased research about safety and efficacy of the marijuana products being consumed by millions of Americans. Unfortunately, comprehensive research on marijuana has been regulated in a restrictive, time-consuming way, and the current body of research is not representative of the products available to the average American adult consumer. H.R. 5657 is a bipartisan bill that streamlines the registration process for scientists seeking to engage in cannabis research. It also maintains the appropriate oversight and control by the Department of Health and Human Services and the Drug Enforcement Administration. The bill requires HHS and DEA to respond to registration applicants in a timely manner and expands the number of federally approved manufacturers and distributors that can supply marijuana products for research purposes. The bill also creates a special process to allow state-authorized marijuana to be used for research projects. And this is an important step towards understanding the positive and negative health effects of the products being frequently consumed by people across our country. The House passed this bill by a voice vote in the 116th Congress. The Senate also passed a similar measure last Congress and did so again by unanimous consent last month. So, Madam Speaker, I want to thank Representatives Blumenauer, Harris, Holmes Norton, Dingell, Cohen, Griffith, Lee, and Case for their leadership on this issue. I look forward to working with them and our colleagues in the Senate to expand comprehensive cannabis research and protect the health of our constituents. I urge my colleagues to support this bill, and I reserve the balance of my time.
The gentleman from New Jersey reserves. The gentleman from Virginia, Mr. Griffith, is recognized.
Madam Speaker, I yield myself such time as I may consume.
The gentleman's recognized.
Thank you, Madam Speaker. I rise today in strong support of H.R. 5657, the Medical Marijuana Research Act. I first want to thank Mr. Blumenauer and Mr. Harris, of course, the chairman of the committee, but Mr. Harris and Mr. Blumenauer are the lead sponsors of this legislation. Though our long-term goals for marijuana regulation may differ, the three of us share a strong conviction that scientific data should form the basis for policymaking whenever possible. And so, for 4 Congresses now, we have joined forces to advocate for more research on the use of cannabis products to treat medical conditions. My belief that medical marijuana probably can be beneficial when used in the proper setting for treatment of certain medical conditions is based largely on anecdotal evidence from constituents and citizens. Despite the increasing use of cannabis products around the country, there have been very few legitimate, peer-reviewed studies to determine the effects of cannabis on the body, particularly over a long period of time. This lack of research is due in large part to the federal government standing in the way. Marijuana's Schedule I status makes it extremely difficult for scientists to, 1, obtain approval to conduct cannabis research, and 2, obtain a quality product of marijuana to use for that research. H.R. 5657 addresses both of these issues. It encourages medical marijuana research by establishing a new set of research standards that are specific to cannabis. This will allow cannabis to remain classified as a Schedule I substance while increasing access for those who wish to study it. It also ensures that availability of verified cannabis products necessary for legitimate research by establishing a new registration process. Entities who choose to register and are approved will be able to legally manufacture and distribute marijuana for the purposes of conducting such research. I urge my colleagues to support this bill, and I reserve the balance of my time.
The gentleman from Virginia reserves. The gentleman from New Jersey is recognized.
Thank you, Madam Speaker. I yield now such time as she may consume to Ms. Dingell, who is one of the sponsors of this legislation.
The gentlewoman from Michigan is recognized.
Thank you, Madam Speaker. Thank you to my dear chairman. I rise in support of the Medical Marijuana Research Act, legislation that would modernize federal rules and procedures to facilitate additional medical research into the impacts of medical marijuana. We have seen dramatic changes in the legal status of marijuana at the state level, my state included. Sales of recreational marijuana began in my home state of Michigan in 2019, and medical marijuana is now legal in 37 states. However, the federal framework for conducting marijuana research is decades old and has not kept pace with these changes. Currently, scientists in the United States looking to conduct research on marijuana must contend with heavy-handed, duplicative registration and licensure process. Additionally, researchers are limited to using marijuana grown at a single location overseen by the National Institute on Drug Abuse at the University of Mississippi. Collectively, these outdated bureaucratic barriers and federal roadblocks greatly limit our understanding of the health impacts of marijuana and prevent qualified researchers from engaging in further study. The Medical Marijuana Research Act will modernize the cumbersome process by streamlining marijuana research registration applications. It will also direct FDA to issue guidelines on the production of marijuana and ensure that adequate amounts are available for research. The legislation also mandates a comprehensive review of the available body of research on marijuana by the Secretary of Health and Human Services 5 years after enactment. I'd like to thank my colleagues, Congressman Blumenauer, Harris, Norton, Cohen, Griffith, Barbara Lee, and Case, who led this with me to get this legislation passed. Additionally, I want to recognize Chairman Pallone, Ranking Member Rogers, as well as the Energy and Commerce Committee staffs for their very thoughtful input and efforts. Madam Speaker, it is high time we modernize our nation's federal regulations to facilitate legitimate medical research into the impacts of marijuana, and I urge my colleagues to support this legislation. Thank you, and I yield back.
The gentleman from New Jersey reserves. The gentleman from Virginia is recognized.
Thank you, Madam Speaker. I yield to Mr. Harris as much time as he may consume.
The gentleman is recognized.
Thank you very much, Madam Speaker, and I want to thank the gentleman from Virginia for yielding me time. You know, Mr. Blumenauer and I have jointly lead-sponsored this bill for 4 Congresses. You know, although we disagree about recreational marijuana, he supports it, I oppose it. As a physician, I realize that if we're going to have medical marijuana legal, as the gentlelady from Michigan says, in over 3 dozen states, we really ought to do research on it to see what it's used for and what it can't be used for. Because, Madam Speaker, many claims are made about it. Some are legitimate, some are illegitimate. The American public, if we are to have this product legal in 37 states now, they deserve to know whether it works for what the claims are made. So what this bill does is simple. It makes it easier to do rigorous medical research, the same type of research we expect to be done on any of the drugs that are sold as medicines in this country. That's what this bill does. It's been a long time coming. I want to thank the chairman for bringing this bill out. Hopefully it gets across the finish line in both houses and goes to the President's desk for signature, because, Madam Speaker, the American public deserves to know what medical marijuana is useful for, because, again, for anyone who has one of the conditions that it might be useful for, this could be a godsend. For other conditions where it's claimed, it'll be found to be not effective. But the American public needs to know the Medical Marijuana Research Act is the way to get this done, modernize our research methods, bring them up to the scientific standards we use for every other type of medication in this country that's sold as a drug. So, Madam Speaker, I support H.R. 5657, and I yield back the balance of my time.
The gentleman from Virginia reserves. The gentleman from New Jersey is recognized.
I have no additional speakers if the gentleman is prepared to close.
The gentleman reserves. The gentleman from Virginia is recognized.
I am prepared to close.
Gentleman's recognized.
I would say, Madam Chair, you've heard the comments from both sides of the aisle. We need the research. It's good for the American public to know whether or not this stuff works. But when you hear accounts from citizens that they're having to buy marijuana on the street, or maybe they can get it in some of these states now, but when you're dealing with epilepsy, for example, they have to boil up a tincture to make sure that it's got the CBD and some level of THC. but nobody really knows what level of THC is necessary to help with juvenile epilepsy. We just don't know. We have no research. So parents out there concerned about the well-being of their children have turned their children into guinea pigs, and yet because in many states it's still illegal and was illegal till just a few years ago, they haven't been able to report their findings to anybody who's working on this in an official sense. It's time that ends. Let's do research on cannabis. I yield back.
The gentleman from Virginia yields back. The gentleman from New Jersey is recognized.
Thank you, Madam Speaker. And let me agree with my Republican colleague that this is very important because there really hasn't been enough research done on marijuana and the impact. So that's why this bill really needs to pass. And I would urge my colleagues on a bipartisan basis to support it. And I yield back.
The gentleman yields back. The question is, will the House suspend the rules and pass the bill H.R. 5657 as amended? Those in favor say aye. Those opposed, no. In the opinion of the chair, two-thirds being in the affirmative, what purpose does the gentleman from Virginia seek recognition?
Ask for recorded vote, please.
Pursuant to Section 3 of House